So because of this situation, a lot of unique techniques was developed in Israel, mostly through different art therapies. So funny enough, we found out that those techniques are really effective in the Japanese culture and the Japanese context. And it's mostly because we talk about non-verbal approaches. So these are techniques that you don't necessarily need to speak about what you feel, but you can express it through art, through movement, through music, through drama. And this is basically what we're doing. So just going over the presentation, when we came back to Japan after this first activity, we came back the second time in Gogatsu in May. We conducted this workshop and training for the teachers, and we gave them very simple tools that they'll be able to use with the children. The first thing we found out, obviously, was that the teachers themselves having difficulties and stress, and they need a place also to share how they feel and to express themselves. And those teachers in Wataricho, they became our biggest promoters. So from this small town south of Sendai, we started to work in 7 cities in Miyagi and Fukushima prefecture. Right now, we're already more than 11 months after, almost 11 months after, and we are working with more than 25 groups, mostly in the Kasetsu Jutaku areas, also in the temporary houses area, sorry, also in kindergartens, schools, in 5 hospitals around Fukushima area, and we conduct this ongoing therapy training, and it's running well. And we realized that, as Dr. Goldman mentioned and as Niwa Sensei mentioned, this is not a short-term thing. There is definitely a need for a long-term process and rehabilitation process, and we are planning to stay and continue this program until the end of 2013. So far, we worked with hundreds of teachers, social workers, mental health professionals. Sorry, could we go back to the, okay, great. And we expanded to the temporary houses areas, as I mentioned. Recently, we found out that not only post-trauma, but also leadership and community development and mobilization is something that is very important, especially in the temporary houses area. You know, we always say kasetsu. Kasetsu means temporary, but when we ask the people there, how long are you planning to stay here, they have no idea. And this is one of the main sources that we identified for the stress. The goal is to strengthen and provide community building tools and reaching the thousands of fragile and displaced people. For us, it's very, very important to work with the local NGOs and the local resources, as I mentioned, and to empower local stakeholders, local government, NGOs, community leaders, students, and young professionals. For every group, it's important to say that we design a different program, because obviously the program that when we are training social workers and when we are training community volunteers, it's completely different. So we can move to just a little bit of explanation about the different methods that we're using. So the first one is art therapy. Art therapy is basically indirect and non-verbal approach to emotional and psychological expression. It's an integral part of Japanese culture, and it's allowed people to use their imagination to create a better future. This is very important to understand. We are not telling the local people, you will have PTSD. We're not even using the words kokoro no care. As Niwa Sensei mentioned, when people hear these words in Tohoku, automatically, usually they refuse. when we are presenting our program to the local people, we say, this is prevention. We are trying to provide you with the tools that will help you develop tools such as creativity, imagination that will help you deal with future difficulties and future trauma and future crises, basically. So that's art therapy. You can see, I don't know if you can see, but the picture on the down side on the right, it's a very special method that was we did with teachers and children in Yamamoto-cho. And in this picture you see the human body there and painted in different colors. So on the left page, on the page on the left, you have 4 main feelings, such as fear, kawaii, kanashi, sadness, ureshi, I think, which is happiness, and what's the 4th one? I can't see from here. But basically, as you can see, it's a very simple way that it's a very simple way for people to express how they feel without speaking about it. You can see that in this picture, she chose the teachers who painted it, she chose the color gray to express kanashi, to express sadness. So most of her body is painted with gray, and we could really easily understand how she feels. Let's move to the next one. This is movement therapy. Movement therapy we found out to be really effective, also for the short term, because when people are doing movement therapy or practicing movement therapy, they feel relaxed. They feel relaxed, they feel relieved. Many of the old people that we work with in the Kasetsu Jutaku area, they told us that after they did this movement therapy, they could simply go to sleep at night. And this is a very important point. Basically, movement therapy allows people to physically release their tension and stress as a preliminary means of intervention, based on physical exercise as well as dance and relaxation techniques. Let's move to the next one. Drama therapy. Drama therapy is also a creative and effective way to develop a wide repertoire of social behaviors and roles. Individuals learn how to express their emotions and thoughts as an indirect product of being part of a theatrical exercise or production. The next one, which we also found really effective, especially with children, is music therapy. Music therapy can be used as part of an interpersonal process with a trained music therapist engage the groups, and or a group activity that promotes creativity and expression as well as improves health. And you can just see the look on the faces of the children there. I think it says everything. The last method that we used is guided imaginary. Guided imagery is a relaxation technique that is useful in the reduction of physical and emotional stress. It helps develop coping strategies for future traumas, and it's also something that's very, very simple that anyone could practice for himself, for his family, and of course with the children in the kindergarten or with the old people in the temporary houses. So just in order for you to understand better what all those therapy means, we have a short video to show you. This video was taken in a small town in Fukushima area with Yochien teachers, with kindergarten teachers. So let's start.
But I would like for some of you to show us and to tell us what they felt when they did it and when they look at it.
とてもお掃除の時間で忙しかったんですけど、近くにおって。
If you are very, very small, would you like to go inside?
この中に入りたいですか？入ってみたいです。Yes, I want to go inside.
What's inside? Now let's imagine that you are inside.
もし自分中にいると
What do you see there?
何を見える
What do you feel there?
どういう感じしますかどういう気持ちしますか
でも誰か連れてっちゃう。一人は山まで。
How can I help you if I'll be with you?
手を貸してほしいです。
You
手を
see,
つないでってほしい。
just hold my hands like this.
Okay, I'll come. Now, we are inside. What do you want to tell me?
何を話してほしいんですか
そうですね。私ちっちゃい頃からおてんばだったので、真っ黒で、今の子供たちは遊べないのがかわいそう。
Believe it? Now the kids cannot play outside. This is very sad for her.
ね、自分はいっぱい遊んできたから。
Because she could able to play so much when she was little. But now the kids couldn't play is a very sad thing for her.
Okay.
So, just to explain about what we just saw, it's a short example. This activity we did when we first met the teachers, and instead of asking them, "O genki desu ka?" Last minute. Okay. Okay. Just to conclude, I would like to say thank you very much for inviting me, and also that we connected to what Niwa Sensei and Dr. Goldman was mentioning before. There's definitely a need for something new, but we believe that those new approach will and could develop from the local resources and from the people in the area that are experiencing the stress and have the capability with the right training of actually dealing with it. どうもありがとうございました。
ありがとうございました。